Assalamu alaikum to our Muslim community in the UK and specifically in Wales, and welcome to this Healthy Ramadan series. On behalf of Diabetes UK Cymru, Cardiff University School of Medicine, and Diabetes and Ramadan International Alliance, I would like to welcome you all to this webinar, which is hosted and broadcast by Muslim Dr. Cymru, and you can check out us on Facebook Live, and supported by the British Islamic Medical Association, Muslim Council Wales, and Ramadan Radio Ramadan. This year, the Healthy Ramadan Cymru series will be brought to you in 4 languages: English, Urdu, Bangla, and Arabic throughout this weekend. I would like to take this opportunity to thank the 4 Imams and the 11 doctors who are joining us during these webinar panels throughout the weekend. However, before we start, I would firstly like to invite the Right Honourable First Minister of Wales, Mark Drakeford, to open the public webinar series. First Minister, thank you for attending, and the platform is yours.
Well, Kasim, Prynhawn da, good afternoon. Thank you very much for the opportunity to be with you this afternoon. As we all know, the last 15 months have been a real challenge right across Wales. Many difficult things having to be faced and worked through. But one of the great things to come out of it has undoubtedly been the founding of Muslim Doctors Cymru, with everything that you have been doing to make sure that accurate information, strong public health messages, accurate clinical information is available to people in the Muslim community here in Wales, as well as the direct clinical activity that you have all been involved in. It was a great pleasure to be with many of you last Sunday in my own constituency in Riverside in Cardiff, seeing a vaccination centre happening at a major mosque with the support of the mosque authorities, of local community leaders, and crucially of Muslim Doctors Cymru as well. And today it is great to see the work of the group being extended beyond the immediate crisis. So in the holy month of Ramadan, those of us who do not exercise the discipline that those who take part directly in it do, have always thought that being able to deal with the demands in a way that is healthy would always be a challenge for people. But in the extraordinary circumstances we still live in, where people don't have direct recourse to the normal networks of support that they would have, don't come together in the way that would otherwise always have been possible, then the need for authoritative advice, forums where people can have discussions, where questions can be asked and answered, that just seems to me to be even more important in this extraordinary year. Now, you have assembled an amazing cast of people to be part of this weekend's events. And I think it's a terrific feat of organization that you've managed to hold webinars in 4 languages over just one weekend. And the focus on diabetes, with Diabetes UK and Diabetes Cymru and the clinical associations that work alongside them. We know how important that is in the Muslim community. And being able to hear directly from faith leaders and clinical leaders to put questions and have those answers, I think it is a real public service that you will be offering, and it will demonstrate to people once again the case for the new organization that's been created, the contribution that I know you wish it to make and I wish it to make here in the life of Muslim communities in Wales. So diolch yn fawr. Thank you all very much indeed for the contribution that you are making in the pandemic, but also now more broadly in the lives of Muslim communities, people of the Islamic faith here in Wales, making sure that they have the advice they need for a healthy Ramadan. And that goes alongside all the other great qualities that Ramadan celebrates. The peaceful nature of the Muslim faith, the emphasis on generosity and thinking of others that the month of Ramadan brings into the lives of people. And now adding today's webinars to all of that, I think is a fantastic new addition to what is available here in Wales. And I end again just by thanking all of you for everything you have done to make this possible. Diolch o galon I chi gyd.
Thank you very much, First Minister, for your kind words. And we hope that you continue to remain safe, and good luck in the future. Bye-bye. So we will be continuing the webinar, and just some housekeeping rules. As you know, we're on Facebook Live. I will be introducing the panel shortly, and also you can ask questions on the Facebook chat, and we have some of our helpers in the background who will let the panel know what the questions are that you may have with regards to having a healthy Ramadan, or in terms of sort of managing your diabetes. So firstly, I'll introduce myself. My name is Dr. Kasim Ramzan. I'm a GP in Newport, and I will be chairing today's English webinar. I'm also a member of Muslim Doctor Cymru. And I will now go around the panel in no particular order. So if we go to Dr. Mohammed Naseem, if you could please introduce yourself today.
Assalamu alaikum, Borida. My name is Irfan Naseem, Dr. Irfan Naseem. I'm a GP in Cardiff-based surgery. Have been working there 18 years, serving the local community, which is a multi-ethnic community. I'm also a member of Muslim Doctors Cymru, and have an interest in diabetes, and have an interest in advising patients during Ramadan, because a lot of our patients need that advice. Many years ago, this was not part of accepted remit, but now it's come to the forefront, and I want to thank everybody else for all their hard work in making these issues very public and very significant. Thank you.
Thank you, Dr. Irfan. Sheikh, Dr. Mohsen, if you could please introduce yourself.
Assalamu alaikum. My name is Mohsen Elbeltagi. I'm a PhD from Al-Azhar University in Egypt, and I work in Swansea University as a Muslim chaplain and interfaith lead. I was formerly I was former Imam of Swansea University Mosque for many years, and I do serve the Muslim community in Swansea and Wales. Thank you.
Dr. Emaad?
Assalamu alaikum, everybody. My name is Dr. Emaad. I'm also a GP in Cardiff-based surgery. I work with Dr. Naseem. I'm also a member of Muslim Doctors Cymru and a member of the Muslim Council of Wales.
And finally, by no means least, Dr. Mohammed, who's been instrumental in getting this off the ground. So Dr. Mohammed, if you could please introduce yourself.
Thank you, Kasim. Assalamu alaikum, everyone. My name is Mohammed Alhadj Ali. I'm a lecturer of diabetes endocrinology at Cardiff University School of Medicine. And I'm very much passionate about serving people with diabetes through the clinical work I do, as well as the research we do in the area of diabetes. I'm very much passionate as well about public engagement and humanitarian causes. I'm a member of MDC, Muslim Doc Cymru, and very proud to be with you today.
Okay. So let's start off. Sheikh Saab, as Muslims, we know that fasting is one of the 5 pillars of Islam. So when we talk about health and illness, what can we learn from the Quran in terms of people fasting in the month of Ramadan?
Bismillah ar-Rahim. As Allah subhanahu wa ta'ala mentioned in Surah Al-Baqarah, starting from the ayat 183 till 186, Allah subhanahu wa ta'ala described as-siyam, and Allah azza wa jalla says, Ya ayyuha alladhina amanu kutiba alaykum as-siyamu kama kutiba ala alladhina min qablikum. Or you who believe, this siyam was prescribed for you as it was prescribed for people before you. And the main aim, and Allah subhanahu wa ta'ala give us the goal of fasting by saying لَعَلَّكُمْ تَتَّقُونَ, so you may achieve taqwa. And in the following ayat, Allah subhanahu wa ta'ala instructed us the way to achieve taqwa as well. In terms of health, and Allah subhanahu wa ta'ala says this siyam is prescribed for you unless you have a medical reason or illness, or you are traveling. Why Allah subhanahu wa ta'ala mentioned these two things? Allah subhanahu wa ta'ala mentioned this in two ayat, and not only in one position or in one place. Allah mentioned this in ayah 184 and ayah 185, and Allah Azza wa Jalla gave the reason for that. Allah doesn't need to give us explanation for His command, but Allah subhanahu wa ta'ala give us explanation for our well-being. And Allah subhanahu wa ta'ala says, if you are ill or you are traveling, you are exempted from fasting. Why? يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. So Allah wants, to make things easy for you and fasting easy for you, which means Allah subhanahu wa ta'ala acknowledges the challenges we may face during fasting. Allah subhanahu wa ta'ala acknowledging the difficulties we may face during Ramadan, in terms of health, or in terms even of our well-being. So Allah subhanahu wa ta'ala give us these excuses, and actually indicates we have to look after our health and our body, even if it was if we have to break our fast to look after our health. Jazakallah khair.
Jazakallah, Sheikh. I'll move to Dr. Emaad. Are there any benefits of fasting for the actual human body?
Several. The main thing people will think about is when you're fasting, you're going to lose weight, and yes, that is very true. Obviously, if you're eating less, you're going to be burning up the calories more, so you will lose weight. That's the obvious example, but there are many other things that happen during fasting that will provide health benefits. One thing that we found in studies is inflammation, which is key to a lot of different diseases. So heart conditions, arthritis, all these cause inflammation in the body. Now, when you fast, actually your inflammation process is decreased. So in things like arthritis, things like heart conditions, liver conditions can improve actually while you're fasting, which is something that we don't automatically associate. There have also been lots of studies about people's brain function as well. So there are people who have had Parkinson's and Alzheimer's who've actually found that your memory is better and your brain processing power is better whilst you're fasting. One of the other things that happened in fasting, obviously, when we're not eating so much food, your body's going to try and find energy from elsewhere. So it's going to look in the body itself and look at other materials it can use to provide energy. As a process, what the body will then do is use toxins and clear that and use that to make energy. So a lot of things that you may have built up throughout the year through unhealthy habits start to get cleared out during the Ramadan period as well. Finally, there's lots of other things, but just to keep things very brief, one of the other things that is promoted by fasting is you have an increase in something called human growth hormone. Now, human growth hormone is really important in its role in repair and growth, and it helps with sort of muscle strength and exercise performance. So when you're fasting, your body's producing more of this. So in turn, your body's becoming stronger rather than weaker as a process of fasting. So yeah, there's lots of benefits, and you see that now. It's not just Muslims who are doing fasting. You see people in sort of mainstream health and fitness that are talking about intermittent fasting, or the 5-2 fast, where they fast for 5 days and they eat normally for 2 days to try and help lose weight and improve their health. So there's a lot of benefits to fasting. All these sort of very brief, but it's not just all about weight loss. It's not all just about trying to lose that belly that you've built up over the last 12 months.
Just got Dr. Emaad. Dr. Afan, so Dr. Emaad mentioned about sort of the physical benefits with regards to fasting. Are there any sort of mental health benefits when it comes to fasting?
I think people would know, they would feel it themselves, really. I mean, let's break it down. So that, generally speaking, people, when they fast, they tend to feel inside, they tend to feel spiritual elevation. They tend to feel a feeling of well-being, brotherhood, happiness. But these are just anecdotal things that people tend to feel. And if they're not fasting, say somebody's got a condition like a severe medical condition that they can't fast, then they will feel excluded, and generally they will feel down or low in mood. But majority of these emotions, they have a scientific base around them. As Dr. Emaad mentioned, there's changes that go on in the brain function and in the hormones that are released by the brain when somebody fasts. And these hormones tend to actually dampen down the inflammatory process which goes on in the brain. And a lot of these illnesses, mental health illnesses like depression, anxiety, and even some psychotic illnesses, which are illnesses where people lose touch with reality. They're caused by inflammation, and these hormones, because there's increased hormones within the blood during fasting, these conditions are less prominent during during fasting time and when people fast. And that's why a lot of people have taken to intermittent fasting and these diets, because they've realized the mental health benefit of fasting. Yeah, I think it also gives the body time to relax and recharge, and the brain to relax and recharge and get rid of all the debris and all the toxins which have built up in the brain and throughout the rest of the year. And those toxins can be quite harmful to brain function and can be quite detrimental to people's mood and the way they feel. So it gives the brain time to relax and recharge, and that will improve mental health.
Jazakallah, Dr.
Afan.
Before I move to Dr. Mohammed, I'm just going to again remind our viewers, please ask some questions in the chat box, and I can then pass it on to such an illustrious panel of members that we've got here. So please take that opportunity on board. So, Dr. Mohammed, there have been some studies that have shown that fasting in Ramadan actually lowers blood cholesterol. Why is this beneficial for us at all?
That's quite an important point, actually. In addition to what my colleagues mentioned here from potential benefits, which are associated with fasting the month of Ramadan, I would focus here on cholesterol, probably on this point. So it has been found that fasting the month of Ramadan will definitely impact on lipids and cholesterol. And when we talk about cholesterol, that will lower and reduce the bad cholesterol, and that will increase the good cholesterol here, which is named HDL. In a previous study, in people with diabetes, those who were able to fast the month of Ramadan, when they fasted, it helped them to reduce the bad cholesterol, to improve the good cholesterol, and to lower their lipids as well. And in a recent study done by cardiologists in United Arab Emirates, also for those who've been fasting the month of Ramadan, it has been shown that it would definitely help with the bad cholesterol to be lowered and reduced, and to improve and rise the good cholesterol. What does that mean clinically here? So that will be associated with good benefits for the heart. And when we talk about the heart here, that means it will reduce the risk of heart disease, heart attacks, and also reduce the risk of stroke. And that's quite important, really, from this fasting process for 30 days. So it's not only talking about like a weight reduction, it's above and beyond that one, really, when we talk about the inflammation and also a direct benefit on blood lipids and cholesterol. So one of the things as well, which is important, it has been found that continue on a healthy diet following the month of Ramadan, after achieving that good reduction in cholesterol and lipids, will maintain as well these benefits on cholesterol and lipids. And that means as well that will maintain a reduced risk of heart disease and stroke. So please always think about that one as the major goal when we talk about like the health benefits for fasting the month of Ramadan. So cholesterol will be lowered, especially when we go and follow a healthy diet during the month of Ramadan. It's a momentum for change, and we advise all people, public, to take that momentum to achieve the maximum benefit of fasting during the month of Ramadan.
Jazakallah, Dr. Mohammed. Imam Sahib, Sheikh Sahib, some Muslims can be unwell or ill during Ramadan, and the doctors may advise them to avoid fasting. What can we say to them?
I think, as Allah subhanahu wa ta'ala mentioned, the purpose of fasting is to achieve taqwa, being conscious of Allah subhanahu wa ta'ala. One of the requirements of taqwa is to look after your body and to take care of your health. And this is one of the principles of Islam. The main goal of the Sharia is to protect our body, protect our health from any risk. So the scholar of Islam agreed upon one principle on fiqh. Any action could lead or cause harm to your health, body or well-being, or put your health at any risk is considered as haram. Not only is permissible to break the fast, in some cases, if fasting or even halal thing, if the doctor say, for example, the drinking water in such and such time after operation or doing such and such thing after operation, for example, is will put your health at risk, is considered as haram, because the main goal of Islam is, one of the main goals of Islam is protecting our body and our health from any damage or any so we in Islam, we need to in this case, a person need to break his fast and follow the medical advice from his doctor and make up later the fasting if he's able to do so. Jazakallah.
Jazakallah. Dr. Mohammed, I'm going to come back to you. As you're a specialist in diabetes, as a diabetologist, what can you say to people with diabetes, especially those who wish to fast in the month of Ramadan? What advice can you give them, please?
Thank you for this question. So the first advice always, if they're not sure about the control of diabetes, they have to seek medical advice. And seeking medical advice is always important for all diabetic patients in their annual review, or when they meet with their GP, or when they speak to their DSN, diabetes specialist nurse. And the way how they do it then, they will score the risk of fasting for people with diabetes. And according to that one, people with diabetes will be classified as a low risk or a moderate or a high risk to fast during the month of Ramadan. And when we mention here the word risk, that means risk of complications related to fasting. And that may include the low blood sugar, known as hypoglycemia, or the high blood sugar, in addition to production of ketones, which is known as diabetic ketoacidosis. So it's quite important for people with diabetes really to know exactly where they stand on the scoring system, whether a low, moderate, or a high risk here, to prevent against these complications. If I have to simplify now the scoring system, I would say that people with type 2 diabetes with no complications, who are well controlled and well managed, and they don't suffer from any other chronic conditions, they will be usually classified as a low risk for fasting in the month of Ramadan. People with type 2 diabetes who may have other conditions or who are not really very well controlled and managed, then they may move to a moderate risk, and then fasting the month of Ramadan here depends on the advice given to them by the healthcare professionals. Those with type 2 diabetes, with chronic conditions or long-term complications, such as the problems happening here with the kidney, with the eye, with the feet, and they are dependent on insulin, especially multiple injections of insulin, in addition to people with type 1 diabetes, as they are relying as well on multiple injections or insulin pumps. These people will be classified always as a high risk or a very high risk sometimes, and they are advised not to fast during the month of Ramadan. It is important, and I need to reinforce again about what Sheikh Mohsen mentioned here. It's about looking after your body. And this is amana, and this is trust. So when advice given to us by healthcare professionals saying, for example, that you shouldn't be fasting the month of Ramadan, we have to follow this advice. And Allah subhanahu wa ta'ala gave the permission for that one. And we have to follow the command of Allah subhanahu wa ta'ala, looking after our bodies very well and maintaining the body in the best healthy condition.
Dr. Mohammed. So we've got a question on the Facebook Live. In addition sort of to diabetes, are there any other diseases that carry higher risk for people who are fasting, Dr. Emaad?
So yeah, there are several conditions that people need to be wary of if they're fasting. Probably one of the main things is Dr. Alhadj has already touched upon, is diabetes. But there are other things such as people who've got very chronic kidney conditions. So your kidney's not working very well. If you're fasting, particularly at this time of year, when the fasts are quite long, you can get dehydrated. And the dehydration can play a part in lots of other conditions as well. So if you have very severe heart problems, so if you have very severe, what we call heart failure, and your heart's not pumping so well, that dehydration can then cause problems with your heart working in that side of things as well. You can also have lots of other conditions which are sort of more mental health conditions, like things like anorexia, bulimia, where you're being treated in a closely, a very controlled way by the team in terms of what you're taking in and what you're eating, and obviously fasting in that case may not be appropriate for you as well. So I think what you should always discuss if you've got health conditions is go to your GP, go to your doctor, and discuss with them and see how the fasting will impact you. Some people have very mild disease, and if it's very mild, you can control it whilst you're fasting as well by making some amendments. However, some people will have more severe disease, and in that severe disease, it's probably best that your GP will advise you not to fast. And as the Imam said earlier, if you do have medical problems, you are exempt from fasting. That is something that in the religion is permissible. So you shouldn't feel bad that you're not being able to fast. It's looking after your own health. But always consult with your GP just to see how severe your medical condition is and whether and how the fasting will affect it, particularly now in the longer fasts that we have.
Jazakallah. Dr. Arfan, as you know, there are many Muslim ladies who are pregnant or breastfeeding. What's the medical position with regards to this?
The medical advice is similar to the Islamic Sharia advice. Anything that harms anybody, or if anybody comes to harm because of fasting, it's not permitted. And you have to remember, when a woman is pregnant, there's two bodies. There's the woman's physical body, and there's the body inside the woman, the baby. They both need nutrition. They both need a blood supply. They both need water. If you're restricting this, going to the baby and going to the mum, potentially the baby could come to harm and the mum could come to harm. And that's not in the Islamic doctrine. And certainly it's not in the medical ethics to make people who are pregnant fast. So it's not permitted from a medical point of view. It's not advised for people who are pregnant or breastfeeding to fast. And I know people they want to fast because they might feel excluded, or they might not get into the whole spirit of the whole occasion of Ramadan. But I think it's important that they heed the advice both of the Imam and both of the doctor when they say it's potentially harmful for them.
Sheikh Saab, for people who fast, they can be on regular medication, and as you know, there's different ways that patients can take medication. It's not just necessarily via the oral route, and this can obviously cause a lot of confusion whether the route that they take in the medication is permissible in Islam or impermissible in Islam when it comes to fasting. Are you able to shed any light into what routes may be permissible and which may not be permissible?
Yeah, I think in general, and to make it very simple for people, anything like through the mouth, which goes to the stomach, this route, is of course will break the fast. And most of the majority of the scholars of four madhahib and others, any other routes will be permissible. But I mean, we, in Islam, the fuqaha always, advise the ill person to try to adjust with professional advice from the professional doctor as well. Try to adjust the route if the medication could be, taken by different routes, or adjust maybe the doses after consultation with doctor, whatever. If there is no way of adjusting the routes or doses, and it has to be taken by mouth, and goes to the stomach, is fine, and the person need to break his fast. But again, the permissible route is anything other than, a majority of the scholars said, anything other than the drinking or putting something through your mouth, which goes to your through your throat, which goes to your stomach.
Jazakallah. Dr. Mohammed, as you know, we've mentioned about the risks with significant health problems and not to fast. However, you know, throughout the world, Muslims with health conditions do fast, and so people with diabetes will be fasting. How would you advise them to remain safe whilst they're fasting?
Yeah, thank you for this question. It's quite important, really, the question here to clarify. So around the world, we have about like 150 million Muslims having diabetes, and it's quite a significant high figure here. And if we look at the numbers of people, it's nearly like 80% of diabetic Muslims, they do fast 15 days and more during the month of Ramadan, which means they're in a quite stable condition to be able to continue fasting for a whole month or something between like 15 days and 30 days. However, to make this experience enjoyable and safe for them as well, we have always to look after our bodies in a certain way. So the first rule here is for people with diabetes to keep themselves very well hydrated during the non-fasting hours. And the hydration here should be done with at least like 2 liters of fluids from different sources in the non-fasting hours, especially now when we talk about the prolonged hours of fasting in some parts of the world. It's quite important. So we have like a limited hours with which people with diabetes, they should keep themselves very well hydrated. That's rule number one. Rule number two, for those who have some medications with a bit of risk of hypoglycemia during fasting, such as people with sulfonylureas, for example, they should check and monitor their blood sugars. And there's a generic advice here for people with diabetes during the month of Ramadan that they have to test their sugars regularly. And when we talk about checking the sugar here, it should be done around like 6 times a day. So one of them around iftar time, another one sahur time, and there should be check in between, which is usually midnight. There should be another check in the morning, another one midday, and the third one late afternoon. This is for the fasting hours. So in total, we talk about like 6 checks for the blood sugar. Also, if they have any symptoms of hypoglycemia, which means the low blood sugar, they have to test immediately. And also, if they think they become a bit dehydrated and having symptoms of the high blood sugars or the smell of the ketones, they have to check the sugar as well and treat that one accordingly. I have to emphasize and mention here that poking the fingers and checking the blood sugar does not break the fasting at all. It does not invalidate the fasting. So it's absolutely permissible, absolutely halal, and it is strongly advised, especially for those who do some jobs, such as people who do taxi drivers, for example, for long hours during the fasting, and they are on certain medications. I would certainly advise them to check their sugars during the day. In addition, there's another advice as well about tweaking the doses of medications or adjusting the timing for them, and that should be done during discussion with healthcare professionals, whether with the GP or the diabetes specialist team, and they will provide the best advice about like the timing of the medications and how to tweak and to adjust the doses. And one of the important rules as well, that people with diabetes, they have to break the fasting immediately and treat the condition if they become very low or very high. So just before the hour of fasting, if blood sugars goes down to levels around like 3.2, they should break the fasting even if there's an hour until the iftar time. So this is quite serious, and the damage coming from hypoglycemia could be a great damage, and Allah subhanahu wa ta'ala asks us to maintain and to keep our bodies in a safe condition. If the blood sugar going very high, for example, a figure 16.7 and above, then we talk as well about a risk of DKA, which is diabetic ketoacidosis, and that's quite a serious condition and can be life-threatening. So in that case, fasting should be broken and people should be well hydrated and take their medications immediately, check the sugars again, and go to hospital if needed. So there should be always, I would say, immediate actions taken in cases of like low sugars or high sugars. These the generic advices always we provide to our people with diabetes.
And I think this question is quite important. So just to summarize, for what Dr. Mohammed is saying is to check your sugars regularly. It does not break the fast. That's correct, Dr. Mohammed. So for a lot of the diabetic patients should go to the GP and make sure they have a number of testing strips there so they can regularly test themselves. And also that if the sugars become too low or too high, that they should stop the fast and seek medical advice. Yeah?
Exactly.
Thank you. Jazakallah, Dr. Mohammed. Very grateful for that advice, as I'm sure that a lot of our Muslim community may be unaware of these simple measures. So thank you very much. So I'm going to go to Dr. Emaad. You know, we've been slowly, the Ramadan's coming earlier in the year. It was, you know, bang smack in the middle of summer a couple of years back, but it's still quite hot. And obviously, trying to stop that feeling of thirst can be quite difficult for a lot of Muslims, myself included. So what simple tips and advice can you give to help people avoid feeling thirsty whilst they're fasting?
Yes, a really important question that affects, I think, everyone on the panel as well as everyone listening as well. So thirst is a big thing in Ramadan. Now, why do people feel thirsty? There's going to be two reasons. Either you're not getting enough water in, or you're pushing the water out too fast. And that can be done for a number of things. So let's try and break it down into taking the water in, which is the main thing in Ramadan. Now, as you know, we can't drink between the hours of between sunset and sunrise. That in the summer in particular, a very long time. On average, we should be taking about 2 to 3 liters a day when we're, well, any day, so fasting or not fasting. So that provides a bit of a challenge when you can only drink in between certain hours and limited hours. So what's an easy way to try and keep yourself hydrated in that time? Now, obviously, if iftar time, people drink water. The temptation is just to down a litre of water as quickly as you can, and that'll solve all the problems. Not the best way. Your body can only absorb water so quickly. If you take on 2-3 litres in one go, you're not going to absorb most of it. You're just going to pass it through and go to the bathroom, and it's just going to come out quite clear. So 100% definitely drink water at the start of iftar, but drink it in incremental, time increments, sorry. So you're drinking every sort of half an hour, every hour, keeping water coming in. So even after iftar, once you've finished, if you're going to the mosque to pray Tarawih or praying Tarawih at home, or just being at home during Ramadan, have a bottle of water next to you and keep slowly hydrating as much as you can until you do fall asleep. Then at suhoor time as well, you need to make sure that you are going to be drinking enough fluid before you start your fast. And as we know, it is sunnah to come and take suhoor. Some people skip it because it's obviously very early in the morning. That's your own choice, but you do risk running into dehydration problems if that does happen. So make sure you do get up if you can and drink again, not in one big rush, but slowly throughout the suhoor period so your body has time to absorb all that water. Now, the other thing we mentioned is if you do things that will promote your body to pass the water out. So what you eat and drink also has a bearing on that. So if you start eating lots of salty foods, you're going to get dehydrated. And we're quite, unfortunately, all familiar with eating unhealthy iftars or unhealthy suhoors with things with a lot of salt in. You try and cut those things down. Other things that will affect the way your body releases or gets rid of the fluid is caffeine. So if you're drinking too much coffee, too much tea, it's going to have what we call a diuretic effect, which means your body is going to try and push that water out, and you're going to be passing more water, so you're not going to be retaining that as much. So in the mornings as well, before suhoor, try not to have anything too salty. Make sure you have things which are high in fiber, which help retain water, and things which are low in salt, which you mentioned as well. Things that are healthy, like salads, always, and fruit, they contain water naturally. So just make sure you have plenty of that during the iftar period and the suhoor period as well.
Jazakallah, Dr. Emaad. I believe we have a question on the Facebook Live. Again, we've been talking about being healthy, Dr. Irfan. Do you have any useful tips for a healthy diet in Ramadan?
I think
especially for me,
taking most of my answer, but I can certainly break it down into very simple form. Okay, so let's look at the plate that we consume during iftar, say. So it's an easy way to think about opening your iftar is divide that plate into fours, okay, into quarters. So a quarter of that plate should be some type of carbohydrate food, like a slow release, a food which releases sugar into your blood quite slowly, okay, in suhoor time especially. A quarter of that plate should be some protein source, like fish, like meat, which will give you energy. And half of that plate should be vegetables, especially during iftar time. So it's important to have a, number one, moderate approach to what you're going to eat. Don't go excessive with the carbohydrates. So all your plate is full of carbohydrate or rice or whatever. It's also important to have a balanced approach. So you have a mixture of different foods on your plate during when you open your fast. And it's also really important to have, as Dr. Alauddin did mention, a lot of fluid in your iftar when you do your iftar to keep yourself hydrated, but have an incremental approach to putting that fluid into your body. So that's really important. Try to avoid really spicy food and really salty food, because these types of food make you very dehydrated. And especially if you've got some type of background illness, say you're on a blood pressure tablet, or you've got mild diabetes, or you've got some, you've got some other illness. It's really important to get the fluid right, because your blood volume is required to give all your cells in your body a good nutrition. Yeah, so it's a sensible, balanced, moderate approach. And don't be excessive. Don't go and have like 3 Mars bars because you want so much sugar in your body. You want to have that quick buzz and then feel full. Because for half an hour or so you'll feel good, but long term that's gonna be detrimental to you, because you're gonna get dehydrated. You're gonna feel hungry again very quickly. So have a balanced approach.
Sheikh Mohsen, I've got 2 questions for you, so I'll just ask them one at a time. So, we're in the COVID-19 pandemic. We're not being able to do our iftars normally. What advice to brothers and sisters can we give, especially those who go to masjid for Tarawih?
Yes, is very important and valid to the current situation as well. I think the number one is very important to follow the protocols of the masajid, the masjid you go, and also the guideline of the government, and follow the social distancing rules all the time, simply to keep yourself safe and to keep others safe as well. And maybe in regards to vaccine as well, it's we don't see any issue with the vaccine at all during fasting. It's completely halal. Is nothing going directly to the mouth or stomach. And if you have been offered vaccine, please do take it, and don't even delay it after Ramadan. If you after you take maybe, I don't know, vaccine, maybe some people they may notice or suffer minor side effect or something. So if they can cope with it, it's fine. If not, if too severe headache or anything like this, so they can break the fast and take the right medicine for it.
I was going to ask about the vaccines as well. So you would advise that people should take the vaccine during Ramadan, and it's okay if a small percentage of them did have any side effects that would cause them to break their fast, then that is permissible, yes, and they can always make this up at a later date.
Yes, and indeed, of course. I mean, delaying the vaccine is not wise idea at all. Delaying the vaccine for fasting is not really advisable. From the Islamic perspective, I have taken the vaccine myself, but this was direct, straight before Ramadan, and I can assure people, inshallah, it's safe, and as far as we know. And as you mentioned, if any tiredness or any side effect, because of vaccine or maybe because of the fasting, we are alhamdulillah exempted and allowed to break our fast. And always remember, what Allah subhanahu wa ta'ala says in the Holy Quran, يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. Allah subhanahu wa ta'ala doesn't want to make things like difficult for you, but delaying the vaccine may put you at risk or put other people at risk as well. So this is better to take it as soon as you have the opportunity.
Jazakallah, Sheikh Mohsen. Dr. Mohammed, what's your advice for people with diabetes in regards to the COVID-19 vaccine?
So for people with diabetes here, having diabetes doesn't mean that these people are more likely to contract or catch COVID-19. However, we have to say, if people with diabetes do contract COVID-19, coronavirus, then they are more likely to have some severe illness or complications related to coronavirus. For that reason, we strongly encourage people with diabetes to take the COVID-19 vaccine. Whatever type of vaccine offered to them, they should take that one, and they should not postpone their appointment during the month of Ramadan if they've been offered such appointment. It's quite important, and we always look at the vaccines of COVID-19 as the most effective way to prevent against any severe illness or any complications related to this virus if people with diabetes would contract this virus. So it is important to take it, and I would say if any side effects may happen, so there will be like minor and easy side effects. These side effects can be managed at the hours of non-fasting by good hydration, by taking some paracetamol, by getting some rest inshallah, during the non-fasting hours. And if any more severe symptoms are happening after taking the vaccine, then Allah subhanahu wa ta'ala intends for his servants the ease, not the hardship. Then they can break the fasting, and they can manage that one and seek medical advice accordingly. Again, I would say to all people with diabetes, please take the vaccine when this is offered to you by the health authorities. If this is offered during the month of Ramadan, do not hesitate to take that one. It will prevent you and will prevent other people as well against any complications or illness related to coronavirus.
Jazakallah. Dr. Afan, so obviously Dr. Mohammed said that people with diabetes should have the vaccine. Does that apply to people with other chronic conditions as well?
I just want to echo what Dr. Mohammed said. He's put it in such an eloquent fashion that we should be having the vaccine, even if we have these chronic illnesses. That's the main reason we should be having the vaccine and get protected. Because if you've got heart failure, or you've got some underlying significant illness like kidney failure or whatever, and you don't have the vaccination, you're going to put yourself at a huge risk of developing complications, becoming really ill with coronavirus, or God forbid, even dying from it. So it's really, really important that you have your vaccination. When you fast, it's totally halal to have your vaccination when you're fasting. We have these questions, on the telephone. We book the appointment for the patient. The patient phones up and says, it's Ramadan. Can I have my vaccination? Yes, you can have your vaccination during Ramadan, and I'm sure Imam, the Sheikh, will second what I'm saying without any hesitation. It doesn't break your fast, and it's really important, if you've got an underlying condition, to get your vaccination done and protect yourself and protect others. Don't forget that. You're not just protecting yourself by having a vaccination, you're protecting people around you. And sometimes I find when I promote the vaccination to people and I tell them they're not just protecting themselves, but they're protecting others around them, they're very, very forthcoming in having the vaccination, because they want to do good for others as well.
Dr. Emaad, we're now in our second Ramadan in the era of COVID-19. Obviously, restrictions are starting to ease a little bit. What general advice would you give to Muslims who fast during Ramadan, and in the era of COVID-19, and trying to remain safe with that as well?
I think, what you've mentioned there is very important. We are still in a pandemic, not come out of the pandemic just yet. Although things are looking better, especially in this country, you don't need to look very far to see how badly it has been around the world. So if you look at, well, India, Pakistan, there are still things going on. So what I would advise and really urge people to do is still respect that we are in the middle of a pandemic, still do the things that have been advised. Wash your hands regularly, keep the distance, wear your masks, and if you're inside, ventilate. It's very tempting, especially in Ramadan, because now the mosque is open, we're praying Tarawih together again, is start congregating and start shaking hands and hugging and things like this. And although, yes, we do miss that, we miss our community, it's really important, as Dr. Irfan said, to protect the community and keep everybody safe, to maintain what we've been doing so far, to keep pushing the numbers down so that one day we don't have restrictions anymore. One day we can pray shoulder to shoulder again. One day we can sit together and eat iftar as a community once more. And when Eid comes, we can hug everyone we want to. But that time's not just yet. So I'm going to say again, just please, a little bit more. You've done so well, everybody. A little bit more. Just follow this guidelines a little bit more until those numbers drop down a bit more. And when it's safe, we can go back to doing these things we all enjoy and we all miss about Ramadan and beyond Ramadan.
Thank you, Dr. Ahmad. And obviously with the restaurants opening up and certain households being able to meet, it's even more important to follow those numbers exactly to what the government tell us and not to exceed them, you know, especially as you said, you know, with the joy of now things opening up during the month of Ramadan and wanting to meet people that we haven't met for such a long time. I believe there's another question on the Facebook page. It's quite a generic question, generalized, without much detail. So I'll open it up to the whole panel if anyone wants to answer it. But the question is, if a person takes regular medication and is not allowed to swallow the tablet during the fast, how should they take them? And obviously I don't have any specifics regarding what tablet they're on about, but is there anything general that the doctors could maybe add in here?
I think it'd be nice to get the Sheikh's point of view in terms of that first, and then we can maybe touch it with a medical point of view.
Yep.
I think if we change, yeah, as we mentioned before, changing the route of medication could help, like taking maybe injections or I don't know, maybe with some illnesses, maybe creams or inhalers or something like this. These kind of things do not really break the fast in general, as long as there's nothing goes directly to the stomach. Changing the route, with the professional advice from the doctor, if it's possible, it's fine. Or maybe, as we mentioned before, changing the doses, the amount of doses. Maybe some doses, as a doctor, better, or type of medication works like longer than the other. But in terms of maybe taking injections or sprays, maybe something like eye drop or ear drop, something like this, do not really break the fast at all. If we say something related to nose, maybe someone is taking medication for nose and as like nasal spray, for example, if a small amount and doesn't go to the throat, there's no problem. And this is the fatwa from the Saudi Council of Fatwa as well. I mean, in general, changing the route will help. If not, and is really serious and he has to take his medicine, so he could break his fast and make the day later, inshallah.
Thank you, Jazakallah. Any of the doctors want to add anything, or should I add something?
If I can add something here quickly, I think, as a general rule, it depends on the frequency of the medications. Some medications should be taken, like, for example, 4 times a day or 3 times a day. Then it would be like a bit harder job to tweak them. Generally speaking, if we have like medications twice a day, such as the case in diabetes, for example, then we can tweak these medications around iftar and sahur time. And we can do it that way. However, that should be upon advice as well, or with advice and consultation from GP or the diabetes specialist team. And that can be sometimes as well associated with like a reduction in the dose or tweaking the dose during the month of Ramadan. And the process sometimes starts like a bit of time, a few days or a few weeks prior to Ramadan, and adjusted during the month of Ramadan. So I would say taking the tablets during the non-fasting hours between iftar and sahur. This is something feasible for some diseases such as diabetes, but again, it needs to be discussed with the healthcare professional.
Yep, I would agree. Obviously, there are some medications, if they speak to the doctors, they may not need to take, or there may be some medications that they can change the timings from between Iftari and Sehri. But again, to do that on the advice of the doctor, that's not a generic rule for all medications that you're taking. And that can only come from the GP. So in this particular case, we couldn't really give advice because it's a very general question. But there may be some things that we can do. Obviously, if you can remain healthy in Ramadan, some people who have got blood pressure problems, they might find that their blood pressure improves. And so you might even be able to reduce your pill burden or the amount of pills that you are taking. Exactly. So do use Ramadan and do use these tips that these fabulous panelists have given you to improve your health. So that might help. I've got another question then. So let's look at metformin, the tablet that's given in diabetes. Some of them may take it 3 times a day with food. Sorry, what should you do, Dr. Mohammed, in terms of the metformin?
So if this is like 3 times a day with the food, then we can do that twice a day. So one of them will be with iftar and another one with sahur. So I assume those who take it 3 times a day will be like 500 milligrams 3 times a day. So they just skip one in between and leave one with sahur and one with iftar. Some people may take metformin just like twice a day with 1,000 milligrams each. Then we advise them to adjust one of the doses, which is the one with the iftar, for example, and leave the one with the sahur as a usual dose. But that has to be matching with their nutrition plan as well, and that has to be discussed with healthcare professional to make sure that this dose adjustment will be the right decision for them to keep the glycemic control in a good level, and also to prevent against any complications such as hypoglycemia if they continue on the same dose.
So if they are taking metformin 3 times a day, they may be able to, what you're saying is drop the daytime one when they're not eating. But again, it's important to discuss with doctors because diabetes may not only be their medical problems, they may have other issues as well.
Exactly.
It's really important not to just make changes just on your own. Or if you've heard from other people who may be diabetic or have problems, and they've discussed with them in the masjid and asked their advice about what to do. So thank you very much, Dr. Mohammed. So I hope that answered that question. But the most important thing for that is to go and speak to their doctor who can do a full medication review. But it is possible for them to still fast, isn't it, is what you're saying?
Exactly, yeah.
Jazakallah. I'm not sure if you have any other questions on Facebook, Dr. Emaad?
Nothing at the moment, but just to remind everyone, if you have a question, then just type it in the comments and you can try and answer it.
Are there any things that the panelists feel that haven't been addressed on the questions that might be important to bring up at this point?
Can I just make a point? I think we've all touched on it, and I just want to hammer this home, especially to the audience who are probably interested in getting further knowledge about fasting and medical illnesses. As a doctor, we're there for you. You know, so make an appointment with your GP over the telephone or your practice nurse to have a discussion about your plan for Ramadan before getting to Ramadan, so a week, 2 weeks, 3 weeks, a month beforehand. So that gives you time to think about what changes need to be made and to digest the changes, to really think about them. And it gives your doctor a bit of time as well to have a think about your medication, how they can be adjusted. Do you need them? Don't you need them? Can the dose be adjusted? Should you not fast? So when things are cold, not when it's like a couple of days left before Ramadan starts, you go and phone the GP. No, do it in advance. Get things planned beforehand to put you and put your doctor in a good footing as you go forward together during Ramadan. So you're going forward with your healthcare professional to fast in a very, very safe way and to not put yourself at any risk. I think that's really important to have that conversation.
That's a fabulous point you've made there, Dr. Afan. Honestly, I believe some of the guidances do say that, a month or 2 months before, have these chats with your doctor, and even try some fasts. Like I believe obviously Sheikh Mohsen will be able to correct me, but they still have to fast on the Mondays and the Thursdays. So maybe try that a month or two before and see what happens with your sugar levels, or what happens with your blood pressures, and that way that helps the GP when it comes to making medication changes, so that it is safe for you to fast. Because we're not here saying that if you've got a medical problem, don't fast. We're saying how to fast safely, so it doesn't cause any detrimental effect to your health. But you make an interesting point, and inshallah next year we will be planning to do these much in advance. Unfortunately, with the COVID pandemic and things, brought us all together in a good way. But then we didn't have the time to plan this in advance. But we take that point, and we will be doing this much earlier. Jazakallah khair for that point, Dr. Afan.
Just one more point, just a small point, just 1 minute. Years ago, as I mentioned at the beginning of all this, years ago, there was no concept of advising patients during Ramadan. There was no concept. If a patient came to the GP and said to the GP, I've got diabetes, I need to fast. No, you can't fast. It used to be a blanket statement to the patient. Things have evolved, because of the hard work of people like Dr. Mohammed, other people, and it's come into the public domain. It's bread and butter medicine. Even when people are being diagnosed with diabetes nowadays, we can have a discussion. If you're going to fast, we'll consider this type of medication, which won't affect your sugar badly when you fast. So we can even put those things in place before Ramadan, and even when you get diagnosed. So the medical knowledge is there, the expertise is there. This is a specialist discipline in itself, and I think make use of it.
Yep, and I think it's down to our Muslim doctors and our Muslim scholars to ensure that we sort of address these issues, tackle these issues head on ourselves, so that our Muslim patients can fast safely. Jazakallah khair, Dr. Afan. Are there any other points, or shall we round this up, and I'll leave it to everybody to leave a quick parting message to the Muslim community before we close?
Kasim, I have one quick point here, which is about smoking cessation. As you know, smoking is not permitted during the fasting hours. And I would encourage all those who smoking cigarettes actually to take the opportunity during the month of Ramadan and make it as a momentum for them to think of like smoking cessation due to the harms really associated with smoking. So it's a momentum now, and it's a training, and it's an exercise, and that should continue beyond the month of Ramadan. In a similar way as well, lots of good healthy habits in our diet and in our lifestyle as well can be adopted during the month of Ramadan, and we have to think always about changing our attitude spiritually, in terms of like a lifestyle, in terms of the diet, physical activity during the month of Ramadan, and drive that one, inshallah, beyond the days of Ramadan. Ramadan, it's a great opportunity, spiritually, of course, there's no doubt about it, and also for our health and for our bodies, and let's all take the opportunity and spread awareness about that one.
Jazakallah. Okay, so let's round up, and I'll start off with Dr. Afan, if you'd like to just give a closing remarks. You're muted, Dr. Afan.
Jazakallah everybody for this opportunity, and I hope everybody's for the rest of Ramadan is going to be filled with barakah and blessings for everybody. Part of our responsibility as a Muslim and as a human being is to take care of our body, and as well as take care of our spirit. So and to ensure that we do things in a safe way, and that we take advice from people who are able to give advice and who are qualified to give advice. So, and also, as I mentioned when I spoke about the diet, it's important to do things in moderation, not be too excessive, and be sensible in your approach. So with all these things together, hopefully, inshallah, we'll be able to all have a happy and blessed Ramadan, and a safe Ramadan, especially during these turbulent times when we need to be together and we need to concentrate on safety and being a good human being and being a good Muslim.
Dr. Emaad?
Yeah, as Dr. Naseem said, it's important to look after yourself as well as spiritually, mentally, physically. And as the Sheikh has said, Allah will never put anything upon you that's going to be too much for you to bear. So if you're too unwell to fast, that's fine. You're not going to be punished for that. So just bear that in mind. Look after your health and keep safe during this Ramadan period. And with proper planning, you should be able to still fast safely. But importantly, just consult with your doctors, consult with your own scholar to get opinions before Ramadan starts, and then you can make a plan, and inshallah, everything will be fine during Ramadan as well.
Dr. Mohammed?
Yeah, Jazakallah khair Qasim for moderating this session today. I would say firstly, for people with diabetes, there's an application called Dar Safa, which is Dar Diabetes and Ramadan Alliance. Safa comes from like safe fasting. And with that one, you will see like nutrition plan, some advice about exercise, about activity, how you make your fasting enjoyable and safe as well. So we are here to support you. We are here to guide you to say that your fasting will be safe and will be safer when you follow these guidance and these tips about your fasting. For those who are not advised to fast, please do not fast and follow the recommendations from your healthcare professionals and also from your religious leaders, those who advise you not to fast. Finally, I would say, may Allah subhanahu wa ta'ala bless you during the month of Ramadan. May Allah accept your fasting, your deeds, and inshallah, we'll see you after the pandemic when we all gather, inshallah, in public webinars face-to-face. Jazakumullah khairan.
Jazakallah. And before I go to Sheikh Mohsen to close this webinar for us, we will put those information that Dr. Mohammed talked about on the Muslim Doctor Cymru pages. And just to remind everybody who is watching, we have an Urdu webinar at 6:30 this afternoon. And then starting tomorrow, there will be an Arabic webinar at 2 o'clock, which I believe Al Jazeera are also going to be showing. And also finally at 6:30 then Al Bangla webinar. So please share everything as much as you can, because a lot of effort has gone in by all these doctors and imams to come together for the first time in Wales to do these sorts of webinars, and we need your support. And finally, Sheikh Dr. Mohsen, if you could please close the webinar with a few words, please. Jazakallah khair.
Jazakumullah khairan all. I feel, sometimes some Muslim brothers and sisters, they feel too embarrassed and shy to discuss, any religious observance with their medical doctors or even their work or schools, whatever. I can assure everybody in the community around us, all professional services around us are very keen to support Muslims, and I have seen this myself in many places. In Swansea University, which I work, the university itself approached me to share like guidelines to Muslim students and staff, and they're doing everything to facilitate and make this Ramadan easy, and I'm sure with other local services as well. So please, brothers and sisters, don't feel shy or embarrassed to open up and discuss Ramadan with any professional services. I'm sure they will welcome you, and I've been approached myself by a number of schools to talk about Ramadan and how children can fast and not fast. So alhamdulillah, the society and community are open for us, and they are keen to know more about your faith and know more about your fasting. So take this opportunity, inshallah, to spread the message to others, inshallah azza wa jal. May Allah subhanahu wa ta'ala accept our deeds and make us a true servant for him, azza wa jal. Allahumma ameen.
Ameen.